Welcome back. This is In Focus, and it is time now for our twice-weekly In Focus health update. Health reporter Linord Moudou joins us now with some new information on ovarian cancer. Hi, Linord.
Hello, Dimiake. Hello, everyone. New research published in the journal PLOS Medicine shows that taller women have a slightly higher risk of developing ovarian cancer. Scientists analyzed data from 14 countries and thousands of women from around the world. The research also shows that obesity is a risk factor for ovarian cancer. Medical experts recently gathered in Togo to rally support for more funding to improve the risk factors of doctors in hospitals across the continent. They say many doctors are at risk of contracting diseases from their patients, and there needs to be stronger commitment to reduce the spread of infectious diseases between patients and healthcare practitioners in Africa. Participants say there is a lack of protective and safety equipment in hospitals across the continent.
The most important thing and one of the most urgent issues in Africa is the lack of resources and materials to treat patients. We need resources in order to access better medical equipment.
There is now better equipment that can help doctors avoid accidental injections from taking place to healthcare practitioners who are caring for patients. There is also unique medical equipment that protects patients from picking up germs from doctors. I think that today, with all medical equipment available, we have to promote the need for better equipment in healthcare sector throughout Africa.
And at the end of the meeting, participants agreed to lobby their governments to facilitate the supply of sufficient protective equipment to safeguard the health of both patients and health workers. In Ethiopia, a mobile clinic extension program is reaching out to pastoralist populations that are constantly on the move. As the sun rises over the Fik Zone district in Ethiopia's Somali region, families are retrieving water from a well before it gets too hot outside. Nearby, a group of health workers are packing up their medical kits as they prepare to go out into the field. They are part of a mobile clinic that travels the region providing residents with health care services because there are no local health centers. The United Nations Children's Agency is working with the government to provide free medical services to people here. Shamis Ali Hared has brought her baby Hassan for a checkup.
In this area, we have a lot of problems because of the drought. My child and I were very sick and very thirsty. That is why we came here today.
The majority of Fik Zone residents are nomadic pastoralists, and it's difficult to treat and monitor their health because they are always moving in search of water and pasture.
Especially when there is drought, when people cannot come to the health facilities, when they are moving from place to other place, then it's the only way that we can help the communities that are suffering from diseases, from malnutrition, from other health-related problems.
At the end of her checkup, Hared receives medicines for treating anemia, while her son is being treated for malnutrition. The mobile clinics are not able to offer advanced health care for the people here, but they are providing a much-needed service for Ethiopia's nomadic community. Ted Chaiban is the UNICEF representative in the country.
Thanks to these 24 mobile health nutrition team in Somali and 4 in Afar, hundreds of thousands of women and children have access to basic health and nutrition services. As Ethiopia comes closer to reaching the health MDGs, it becomes increasingly important to reach out to the harder to reach, harder to access population, and this is an essential strategy.
The mobile clinic program began in 2004 with 2 teams and has since grown to accommodate a large number of residents. And that's all for today. Dimiake, back to you.
Well, thank you so much, Linord, always for such an informative health segment. And for our audience, please be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on In Focus.